I'd like to place one thing that why, on behalf of our organization, Medical Service Center, we used to study the life struggle of medical pioneers, particularly Dr. Norman Bethune. We, the member of medical community, doctors, nurses, and other healthcare personnel, we think that unless we learn from our ancestors, we uh, can't achieve our quality, we can achieve our goal. If we want to become good physician, if we want to become good surgeon, if we want to become good nurse, then we have to study the life struggle of medical pioneers who invented, who developed medical science, who sacrificed their life, who created the new concept of medical science. That is why not only Dr. Norman Bethune, but other medical pioneers like Andre Vesalius, Louis Pasteur, Benting, all medical pioneers we study, we learn from their life struggle. And particularly for Dr. Norman, for our nation, he is one of our role model because he developed not only um, contributed medical science technologically, he invented many instruments of cardiothoracic surgery, but also he provided important aspects of medical ethics. What Dr. Anirban already told that what will be the relationship of medicine with people. So we particularly emphasize the study of life struggle of Dr. Norman Bethune. Dr. Norman Bethune, you have already heard that he was born in Canada. He was born in Canada. He got undergraduate degree from uh, Canada, and then he did his post graduation in surgery, and he initially he joined Canadian Army during First World War in 1914 when he was an undergraduate medical student. Then he left and he completed his post graduation, and uh, after completing his post graduation he started practice. When he started practice, then uh, he observed that many patients are coming. He was very dynamic. He was very efficient physician. And when he practiced very reputedly and was earning money, his fame, his position, it was being established at that time. When his fame was increasing, he was earning money. At that time also, he uh, did not forget about the poor patient, about the poor people. For him, the doors for the poor and slum dwellers was open. But suddenly he got tuberculosis. At that time, there was no anti-tubercular medicine for the treatment of tuberculosis. The only treatment was to send the patient to a sanatorium. The patient who was having that capability to get the seat in sanatorium, they spend the rest of the life in sanatorium. But the poor people, those who got that tuberculosis, they practically die in the street, spreading the disease. That was the situation. So when he was attacked by tuberculosis, he thought that his life is finished. His hope, his ambition, his everything, it has been shattered. But when he was staying in Trudeau Sanatorium, at that time, his inquisitive mind suddenly found one new method of treating tuberculosis. That is what you have heard, that artificial pneumothorax. At that time, this method was not practiced widely. He insisted the doctor of that sanatorium to operate on himself. He provided himself as a patient and he guided how to operate. And after successful operation, he was cured. And when he came out from that Trudeau sanatorium, he got new life. And after returning back, he again started practicing. He wanted to know about the tuberculosis. As he got new life, then his dream, his ambition was to eradicate tuberculosis from the society, from the earth. So first he went to Dr. Archibald of Montreal. He was a reputed cardiothoracic surgeon. He got training from Dr. Archibald for 2 years. Then he joined his hospital and later he was the in charge of Sacre Coeur Hospital where he performed independently cardiothoracic surgery. At that time, he developed, invented many instruments for cardiothoracic surgery. And when his fame was increasing, many medical students and doctors, they used to come to see his operation, his new method of operation. And by this way, he was treating tuberculosis patient. Many patients he treated. His dream was to remove tuberculosis from the earth, but his observation was different. That was that as he was developing new method of surgery, he was treating tubercular patient, but daily more and more patient was coming. The number of patient was not reducing, but he was treating many patient. So what is the fault? Why tuberculosis is not reducing? Why the number of tubercular patient is not reducing? That thinking came in his mind and he tried to get the answer. At that time also, what I told earlier, that for Dr. Norman Bethune, he was not only the doctor of rich people, he was practically the doctor of poor people. Many poor and slum dwellers, they used to come. And Dr. Norman Bethune also, he is very much comfortable to go to this area to get the patient, to look after the patient, whether their condition is improving or not. In this way, Dr. Norman Bethune's lifestyle, his mixing, it was with this poor strata of the society. So his inquisitive mind started to find out this answer. Why? Why tuberculosis patient it is not reducing? And at that time, one day, he witnessed that one rally was passing. They were demanding employment. They were demanding food. You know, in 1933, in the world, there was an economic recession all over the world. And as a result of that recession, unemployment, price hike, and retrenchment, all these things were there. And the life of the people were miserable. So people, they were also agitated. They were demanding employment and food. When Dr. Norman Bethune witnessed that rally, it was passing, suddenly police came and attacked brutally. Dr. Bethune rushed to the injured person and he started treatment to the injured person. Then another thinking came in his mind that the the doctors, we are treating patient, we are we are doing operation, we are curing a tuberculosis patient, but we are not going to the root cause of the disease. The root cause of the disease lies elsewhere. He studied and he came to the conclusion that the root cause lies in the poverty of the people, that malnutrition, unhygienic environment, workload, all these things are the factors for increasing rate of tuberculosis. So he started another fight. He discussed with his colleague, he discussed with many people that what is the cause? I think this may be the cause. Everybody disheartened him that your thinking is right, your point is correct, but what you are thinking that to eradicate tuberculosis, you have to fight against poverty. That is impossible. That is not possible. But Bethune told that it may be possible, but it is necessary. And if it is necessary, it is not impossible. And when he is practicing, he is observing many things that the corporate business house, they are coming to the medical field, they are doing business. And we, the doctors, we are also being victimized. We are practically submitting to their hand. Then he started to thinking that why we doctors, we are not working freely, we are not able to work freely according to the medical ethics, according to the medical science. At that time, he attended in 1935, he attended one international physicians conference in Moscow, that erstwhile Soviet Union. When he went to Moscow, he visited that country. Particularly, he visited the sanatorium for the tuberculosis. He was astonished. What he thought that sanatorium should be like this, but it was not possible in Canada. But in Soviet Union, they implemented it, and the health of the people, it is their prime importance. In Canada, he observed that government government's attitude is like this, that they are doing charity. They are when they are providing money, the attitude is that they are doing charity. But in Soviet Union, health is like people's right. There is no place of charity. that socialized medicine he came to know. What is the socialized medicine? There is no place for separate private practice. In our country also, what is the situation? In every year, more than 1 lakh undergraduate doctors are being produced. But is there any planning of the country, of the government? What we will do after passing? What will be our duty? There is no state planning in our country also. What we are compelled to do? That according to our own initiative, according to our own planning, we practice. And as there is no state-wise planning, concrete planning, that is we are also compelled to go to them. So in our country also, these things happens. In that time, Dr. Norman also observed in Canada, but in socialist system, there is a concrete planning for each doctor. How many doctors are being produced in every year? They immediately after coming out, after passing, they were included in the state planning. And the development of the health system, it was also surprising. After returning back, he started to propagate the concept of socialized medicine. He, along with William Grant Benting, they wrote article Health Socialism. Then, then at that time, the international situation was very critical. Just before the Second World War, in Spain, there was a civil war that fascist Franco, he, with the backing of Italy and Germany, fascist ruler Hitler and Mussolini, Franco was attacking the democratic elected republic government, and the people they are, were fighting to save their country against the fascist General Franco. And there was an international appeal to all the people to help Spain, to help the democratic, peace-loving people of the Spain against fascist Franco. And Dr. Norman Bethune, he responded to that call. He went to Spain. It was not an easy thing to leave his practice, to leave Montreal, where his fame, where his position was established. It was not a easy thing, leaving all this thing, going to the Spain, because his mind, his approach, it was not too limited in one country. He was driven by the great humanist values and internationalism. He responded to that call and he went to Spain. In Spain, he witnessed that thousands of patriotic people they were dying in the war field. He studied why these things are happening, and he invented that in the battlefield direct blood transfusion method. Initially, it seems very difficult. The officials, they did not agree to perform this procedure. But when Dr. Norman Bethune placed his logic, then they agreed. And after that direct blood transfusion, death rate was reduced to 75%. Then when he was working in Spain, then again another call came from China. At that time, China was attacked by Japan imperialist power, and Japan imperialism, they were invading inside the China, and the Chinese people under the leadership of Mao Zedong, the communist leader, they were fighting, and Mao Zedong called to the people of the world that in China, it is a very backward country. There is no skilled doctor, there is no health system. So our people are fighting. Please help us. And responding to that call, Dr. Norman Bethune, he decided to go to the China. It was also not the easy thing. Spain is different, but China, it is something more different. It is farthest. There is different language, different countries where war is going on. But Dr. Norman Bethune did not hesitate to respond. He went to China, and in China, he worked with eight root army in northern China. He worked and he learned many things. He establishes that mobile medical and surgical team, mobile surgical operation theater. He convinced Mao Zedong that the people of China, they are fighting. There are also many people, they are dying. But if that mobile surgical team is established, then death rate will be less. And he trained the people in China. Dr. Norman Bethune trained the people for minor surgical procedure, for many other things. He trained and he created a team, and they moved from one place to another place where war was going on. And when in this situation in 1939, in November, in a mobile operation theater, they were Dr. Norman Bethune were performing one operation. Gloves were finished. Without gloves, he was operating. He got a cut injury in his finger. But after that injury, it became septicemia. It was not a big thing. If antibiotic would be available, then that injury, it was not a big thing. But in China, there was no antibiotic. So finally, Dr. Norman Bethune died at the age of 49 in China. And the Chinese people, they recognized Dr. Norman Bethune. They prepared many statues, they prepared pavilion, they prepared hospital, schools in his name. So it was the brief life history, life struggle of Dr. Norman Bethune. But it is one aspect of his life. But another aspect, that is when he was moving from one country to another, there is no boundary for Dr. Norman Bethune, where humanity was in distress, where people are in distress. Dr. Bethune rushed, and everywhere he witnessed that the imperialist power, imperialist power, they are brutal. They are attacking people for their profit. And he told that I refuse to live in a world which spawns corruption and murder without raising my hand against them. He directly told. He witnessed that in our society, there are two classes of people. One class is very rich. They have everything. They are power monger. There is no places of humanity, no places of human values to them. Only money, only profit. This is one class, that imperialist power and the ruling that class, they're in this side. And another class is poor people, those who are being attacked, those have no money, those have no treatment, those who are not getting any public services, and they are suffering more and more. Their disease, everything, they are suffering with more and more. So also he told that the situation now prevails that in medicine we are confronting two contradictions. One is that to one aspect is one contents that to maintain our vested interest, maintain our position, the doctor's position, and another holds that the function of medicine is not to maintain our doctor's position. It is something more beyond the doctor's position. It is the ethics, it is the value, it is the relation between medicine and people. Dr. Norman Bethune, he practically redefined the relationship between medicine and people. He redefined the medical ethics. Doctors and medical community, they should be motivated, they should be guided by the ethical values, medical ethics, and that ethics is now being compromised due to the attack of that commercialization, privatization. That was also the fact during the period of Dr. Norman Bethune. He told that the function of medicine is greater than the maintenance of doctor's position. He told. So now in our country, what we are observing, our country, there is a class who have many things, who have everything, power, money, everything. But another section of people, they are very poor. They don't have money for treatment. But what is happening? Many corporate hospitals are being established and government hospitals which are supposed for the uh, poor people, the infrastructure and treatment quality, it is being deteriorating, and the poor people, they are not capable to go to this corporate hospital. Then how we will preserve our medical ethics? Here, Norman Bethune's struggle, we should remember that he fought against this commercialization, against this privatization, against that money monger. So in our country, when the health is being considered as commodity, and where the people's health, it is being ignored in our medical education also, what we are observing, that newer policies has been established when NMC Act was introduced. After that, many new things are being introduced in the name of science. Many unscientific, superstitious content are being introduced in our medical curriculum, and our students, they are compelled to study all these unscientific things in the name of science. If Norman Bethune was alive, then what was his role? He protested in our health system when we are seeing that many people, they are dying without getting treatment. Then if Norman Bethune was alive, what he did? Only doing practice, only earning money. It is not the life of a doctor. It is not the medical ethics. So for doctors, if we want to uphold medical ethics, if we want to practice with dignity, then this fighting character, the pioneers of medical science, we have to study their life struggle. Otherwise, we cannot save us. So in this situation, the study of Norman Bethune, it is very vital. I request all to go through a book. Name is The Scalpel, the Sword. It is the life history of Dr. Norman Bethune. And with this, again, I am congratulating the State Committee of MSc, Odisha State Committee of MSc. With this, I conclude. Thank you.